Hi friends, Sheila Keeter here, teacher for inclusion, and today I would like to talk to you about what a trauma-sensitive classroom is like. Before we get started, let's talk about the definition of trauma. So trauma is an exceptional experience in which powerful and dangerous events overwhelm a person's capacity to cope. And these are experiences, they don't have to be life-threatening, and they're more common than we would realize. So a parental divorce, witnessing domestic violence, death of a loved one, physical abuse, sexual abuse, parental incarceration, homelessness, and bullying. These are all very traumatic experiences that can overwhelm our students and make them incapable of learning or connecting in the classroom. So a trauma-sensitive learning environment has 4 components to it: self-awareness, relationship, belief, and positivity. And I go through each of these, like self-awareness, stay true to your values, stay out of the crazy making, do not make it personal. I talk about the different ways to cope yourself as a teacher when a child is experiencing trauma and has gone down the rabbit hole into that crazy making space, and how you need to respond to it. And one of the main things or takeaways from that section is that we do not take it personally. When a child is having an episode, we don't take it personally because it's not about us, it is about them. And if you take it personally and you play into the crazy making, then there isn't an adult that's in the room. So some of the things to ask yourself, not ask yourself, but ask yourself about students, or ask to students: what is their name? What are their interests? What are their hobbies? How do they prefer to learn? What are their goals? What is their favorite subject? Who's their favorite staff member at the school? How often do I interact with this child? So if you never interact with the child, that's going to be a problem, right? There's no way to do any of the above questions that I just mentioned without interacting with the child. And what interventions have worked? It's always great to go talk to other teachers who have the same child in their class and find out from them what it is that does work and what makes things worse. And I talk here about your emotional response. So take a deep breath. Ask 3 people how they would handle something. Do some research on trauma response strategies. Talk to an administrator, a mentor, or a coach. Sometimes we are not okay, and that is okay. And that goes for the student, and that also goes for us. I mean, we are not always healthy, happy beings. And sometimes it's important to just acknowledge that within yourself, that, you know what, I'm not okay right now. I have a lot going on. I need to take a deep breath. I need to take a step back from this situation. And that is okay. And know that. Watch out for fear. Whenever fear is in the driver's seat, making you make certain decisions or thinking about worst case scenarios, that is never going to end well for you. So watch out for those fears. Be patient. Give yourself and others some grace. And what I mean by that is praise. Praise yourself, what you do, the things that you do. Try to stay away from the negative voice and what you're not doing or you're not doing well. Think about what you are doing and what you are doing well, and praise the students in the classroom as well as colleagues. We all need that from one another. Some self-care tips. We've got some health exercise for 40 minutes or more, at least 3 times per week, and that can be walking the dog. Give yourself compliments every day. Learn or try something new once a week. It makes us feel good. It makes us feel competent and intelligent. And write down something you're grateful for every day, every single day. So I hope that you learned some things about the trauma-sensitive classroom that will help you and help students in your care. to have a better experience in education. And I hope that you have a wonderful day. Thank you so much for listening. Goodbye.